Thank you for having me. I'm very excited to be here and slightly nervous at the same time. But thank you very much. My name is Leigh Bennett. I am a sonographer. I have been a sonographer for 24 years. Sonography is the technical term for ultrasound. Most people have heard of ultrasounds. Most people think ultrasound, babies. There is so much more to the vast world of sonography or ultrasound than babies. I myself went into ultrasound to scan babies. That was my goal. I was 19 and I was like, yes, that's what I want to do. I got in, I scanned babies, I scanned abdomens, I scanned thyroids, breast, livers, gallbladders, pancreases, all the organs, scrotums and testicles. I mean, we scan everything. Vascular, veins, arteries, all throughout the body. 5 years into my career, I had the opportunity to learn echocardiography, which is ultrasound of the heart. And that turned my direction into a whole new field of just falling in love with the heart and scanning the heart and vascular for the last 16 years of my career. So if you ask me where my specialty lies, it would definitely be in echocardiography and vascular, but yes, I have scanned the other things as well. I did, across the course of my career, get registered in each thing as I went along. So I am registered in, there's a test. There is literally a test for every single thing I mentioned. So there is a registry for abdomen. There is a registry for vascular. There is a registry for OBGYN. There is a registry for echocardiography. New registries that are out that I have not taken because they are new are breast. And the newest one is musculoskeletal, because that is the brand new thing they're using for in sports medicine, mainly at like the football fields and stuff, because MRI is not portable. So when a football player injures his shoulder or injures his knee, they can have a little portable ultrasound machine to scan that shoulder immediately to see if there is a tear, if he can go back on the field with some medication, or if he's out of the game. So now it's going into orthopedics as well. So there's orthopedic physicians calling me on the daily going, do you have any sonographers being graduated yet? So sonography is a vast field, and I love it, but I love healthcare as well. And what I have noticed in my 24 years as a healthcare professional is my patients are very unaware of what they're having done, why they're having it done. I mean, it is not a shock at all to have someone come in and say, for me to ask them, what brings you in here today? Why are you here to see us today? I don't know, the doctor told me to come. I don't know. The doctor told me to come. It's almost like the doctor went to their house and said, you must go have this scan. I mean, and I doubt that happened. I'm betting they came in with some complaint, some problem, something that bothers them. But they don't know why they're having the test. They told the doctor what was bothering them. The doctor ordered the test, and now they're in here having a test, and they don't know why. How do you know if you're having the correct test if you don't know why you're having it? I mean, you're putting a lot of faith in your physician, in the healthcare profession as a whole. Now, I'm not saying that there are not wonderful healthcare professionals out there who are totally there for your benefit, and that's their sole reason for going into healthcare. But does everybody have your best interests at heart? I mean, do you really think that every single doctor out there, every single medical professional out there is thinking, oh my gosh, what can I do to make this person's life better? Has that been anybody's experience anywhere? So that's what we're going to talk about today, is why you should self-advocate for yourself, why you should be knowledgeable about what you're having done, why you're having it done, what is self-advocacy, okay? Why are we here? So our agenda today, we're going to learn about self-advocacy. We're going to learn about what that is, what that means. And then we're going to go into sonography as well as diagnostics. I started my career in x-ray. I'm a registered x-ray technologist as well as all those other things. So I started doing x-ray. I did x-ray first. My goal was sonography. But I know that the x-ray world also is out there, and there are so many radiology tests that people don't know what they are. My mother said, why are you talking about that? What does it matter? I said, Mom, if someone sent you to do a carotid Doppler, would you know what you were having done? She said, no. I said, don't you think you should? She's like, I guess. So we're going to learn about the test. I'm going to go over a brief synopsis of a few of the more popular tests that are ordered and why they're ordered. Then we're going to go over the legalities. Are there laws that protect you? Are there laws that say your sonographer must be registered or must be licensed? We'll find out. And accreditations, and what does accreditation mean for your facility that you're going to? Like if you're going to a hospital, is it accredited? What does that mean? So we're going to be in the know. We're going to learn what we need to know to advocate for ourselves when we feel ill or not our best. So I've already done the introduction of pretty much self-advocacy is the healthcare of the practice of taking control, being vocal about your symptoms, being honest about your symptoms, because, you know, leaving things out can lead to mistakes. Even if it's embarrassing, I promise you, it's not the most embarrassing thing we've heard. Okay, we have got some doozies of stories on what people tell us in the room. Ask questions. Why am I having this test? What does this test show? What happens if this test is positive? What happens if it's negative? Is there an outcome to this test that benefits me, or is this test just, you know, a make money test? Because there are tests that can be in the wrong situations, make money tests. So these are the things that you need to do as a patient or just as a human being to take care of yourself. I mean, you wouldn't go buy a house without asking questions and having it inspected, right? I mean, that wouldn't be something you do. You wouldn't say, oh, well, this person's totally on the up and up. There's not a roof leak, because they wouldn't lie to me. I mean, the most recent house I bought had the most beautiful spot for a pool. All I wanted was a pool. There is a pool buried under the ground. Now I cannot get a pool. Was not disclosed to me. So I'm just saying you can't always just think that everybody's in your best interest. So ask questions. So educating yourself. We are in the world of education. I mean, we have more avenues now than ever to educate ourselves. I mean, you can Google anything. I mean, you may get a lot of different responses and it may get very confusing, but at least you'll have a way to say, I read this, is this correct? You can ask the doctor, is this correct? So this is how we self-advocate. So ways to self-advocate: understand your health insurance. Someone was just up here a minute ago talking about health insurance, saying, I help with people with their health insurance. Great. That's wonderful. People need to know about their health insurance. They don't know what's covered, what's not covered. They're afraid to go to the doctor because of the cost. Understanding your health insurance, asking questions, ask questions of the doctor. I mean, that's what they're there for. If you don't understand them, find another doctor. I mean, there's other doctors out there. Get second opinions. Keep health records. Write down what you have. I mean, if you've had the CT, a CAT scan of your abdomen, we need to know that as health professionals. I come in and say, have you had an echocardiogram done before? And they go, yeah, at the hospital the other day. And then I go, really? So they picked things on your chest and rubbed gel and put gel on your chest and rubbed around. Oh, no, I didn't have that. No, I didn't have that. Get second opinions. So if you have a bad feeling about something, trust your gut. If things don't feel right, if things don't, get a second opinion. Nobody's going to get too offended. And if they do, then that's the wrong doctor to begin with. And then think critically. I mean, think about the situation. Think about what's going on in your life. Critical thinking is, we do it on the daily and you don't even know it. Critical thinking is driving down the street and going, this car's jumping in and out of the lane. I'm going to get out of their way, rather than just ignoring them and with blinders on driving straight forward. So think critically. Trust yourself. I've had patients who trusted themselves and got the help they needed, and I have patients that trusted the doctor and didn't. I had a patient one time that literally went to the ER because she just didn't feel right. Her chest was hurting. She didn't feel right. ER did chest x-ray and did a EKG. said, you're fine, send her home. She said, that's just not good enough for me. I don't feel right. She self-advocated, went to her primary care physician. I don't feel right. Primary care physician said, I can't find anything wrong with you, but I will send you to a cardiologist just to check it out. At that point, she comes to the cardiologist. And my cardiologist, end of the day, he had to get to a procedure. He said, I don't think there's anything wrong, but just to be safe, do an echocardiogram. So he sent her to me. I talked to her, what's going on with you? I just don't feel right. I've got this pain right here. It's just not quite right. It's just something's wrong. I have lupus, so I have weird symptoms. Things don't present the way they're supposed to present typically. And in doing her echo, her heart was beautiful, but there was just something wrong at the top of her aorta coming off the heart, the main artery that comes off the heart and feeds the entire body. And I investigated just a little further and found a dissection. And for the people who don't understand what the aortic dissection is, it's literally the inside lining of the aorta is tearing, and it is fatal within 48 to 72 hours of onset.
Wow. Oh my gosh.
So if she had listened to the ER and gone home and said, I'm fine, she would have been dead the next day.
Wow.
I called my doctor immediately. He was in his procedure. The nurse argued with me. She said, he's in the procedure. I said, I don't care. Hold the phone to his ear. I need to talk to him. She held the phone to his ear. I said, I am 99.9999% sure that she has an aortic dissection, type A. It is critical. He says, I'm on my way. He came over himself, rolled her himself to the CAT scan because ultrasound sonography is a screener. We send no one straight to surgery. They has to be checked by another modality to confirm the findings. CT confirmed the findings. She had surgery that night, and she's still my patient to this day, 12, 13 years later. She self-advocated. So self-advocation is the difference of her trusting the ER and going home and dying, or being here 12, 13 years later. So the diagnostic tests that we have, the diagnostic tests that are available to you as patients, radiology, X-ray. X-ray has been around since 1897. 1897, X-ray was invented. X-ray has all sorts of modalities. We have CAT scan, which is, we have straight up X-ray where they take a picture straight of your hands, your bones, your wrists, broken bones, kid falls off a bike, X-ray. CT, CAT scan's a little more in depth. It's the tube. You roll through this little tube, this little donut tube. It's short, and it takes pictures of the organs inside your body, static images of the organs inside your body. Magnetic resonance imaging, MRI, is not quite straight up X-ray. I plugged it under there because it is a subspecialty, but it actually has no radiation involved. It's using a large magnet. So the magnet actually creates the image. And then sonography, which is my baby. Sonography is the one that is slightly different in that X-ray, CAT scan, MRI, all of those, when the X-ray technologist takes the picture, all the information is there. Sonography, however, is not like that. It depends on who is scanning you. We only see what we're directly over. Her heart was beautiful. That patient's heart was beautiful. The pictures of her aorta I took, not even in the protocol. So if I had not thought, hey, that doesn't look quite right there, and done some extra pictures, at the end of the day, when I was supposed to go home, if I had said, I just want to go home and finish the exo, I'm going home, I would have been just as culpable as every other medical professional that she had seen up to that point. So know who's scanning you. Ask questions about their background, what they're doing. You know, how long have you been doing this? What's your specialty? What do you enjoy doing? These kind of things, because unlike X-ray, which every state in the country, I'm gonna go skip ahead and go nuclear medicine. That is where they actually put radiation inside of you. I'm gonna wrap back around to sonography. Nuclear medicine is where they actually put radiation inside you, and they have a machine that reads the radiation being emitted from your body. How's that for you? You can actually set off these scanners at the airport if you don't go with the letter saying, I just had a nuclear stress test.
Wow.
You are the radioactive person. No, you do not glow in the dark. PET scans is one of our newer ones, been around a little less than 15 years. PET scan actually checks for cancer through your entire body. So if you are concerned about cancer, or if you have symptoms of cancer, PET scan is one test that they should order to see. It actually is a CAT scan with a little bit different tweaking on it, and it checks for cancer throughout the entire body.
All types of cancer?
As far as I know, now I'll be honest with you, I'm not an expert in PET scan. Like I said, it is a newer modality, and I've been in sonography for the last 15, 16 years and in a private practice, not in with the x-ray department. If I'd been in x-ray, I'd probably know more about PET scan. But yeah, as far as I know, yes, it is one way to detect for cancer. Is it foolproof? No, all of these are screeners. The only foolproof way to detect for cancer, the only way to know if you have cancer is with a biopsy. That's the only way to diagnose cancer.
How about bone density? What is that?
Bone density is also a CAT scan, different thing that goes under CAT scan. It is actually, or maybe it's not CAT scan. It's a different type of x-ray, and it's looking for osteoporosis or weakened bones.
Yeah.
So bone scans looking for, that's looking for osteoporosis. It's very good at that too. So they all have different specialties, different areas. X-ray, because it doesn't deal with radiation, the government has already recognized that it holds risk for people because radiation holds risks. So there's legalities all around the world. You will not ever have an x-ray technologist who is not registered because they can't work if they're not, because it has biohazards. Sonography, however, is different. Sonography is hands-on dependent. When I turn out my students, my lovely students who have 20 months to become registered sonographers and be out there on the road scanning, or the best of them, they will be as skilled a scanner as your 16-year-old driver. I'm not saying everybody has to learn. Everybody has to learn, and I was there. And what they get out of it and what they put into it, once I put them out in the world, is what they are going to put into that. They need to ask questions. They need to talk to the doctors. They need to find out and be inquisitive. Sonographers are investigators. We listen to our patient who says something doesn't feel right, and then we take the extra pictures. Unlike nurses who follow orders and must follow orders and have to follow the orders, and if they don't follow the orders, bad thing happens. Sometimes if sonographers don't veer from the orders or don't take the extra picture, bad things happen. If we see incidental findings, I have found more incidental findings where I'm doing a heart and I find lymphoma, or I'm doing a heart and I get down here to the bottom to take my very last picture and I see gallstones. Incidental findings have to be reported. But if the sonographer doesn't recognize them as a significant finding, they may not be. So this is where sonography varies from x-ray. When you take an x-ray picture, it's all there. But we as sonographers are the eyes for the doctor. The doctor has to trust that we've seen everything we've seen, we've documented everything we've seen. And that's where credentialing for sonographers and law and reality of us making sure that your sonographer that's scanning you is registered and has been to school and has done the due diligent work is important.
So the doctor isn't looking at the image himself?
Not while we're scanning, no sir. We do the scan and we take it to him, and then he looks at the images that we present as sonographers. So once we present it, he only gets what we present. Now, there are some doctors who will argue with the sonographer, and I'm not saying they are wrong. They will say, you know what, I didn't see this picture clearly enough. I need you to go back in and take another picture. That's great. That's my job as a sonographer, to go back in there and take that other picture. So it depends on the doctor too, what he's doing. So I found this quote, thought it was great. The best way to get started is to quit talking and start doing. So I'm just saying, as patients, you can't completely rely on everyone having your best interest. This are the states that actually have laws for sonographers to be registered.
That do or do not?
That do.
Wow.
That do.
That's it?
That's the only states that have a law that says my students, when they graduate, have to take those tests that I just told you about and get registered.
Wow. That's not scary at all.
Are they looking to change that?
The government doesn't even know we exist as a modality because ultrasound has no provable bioeffects, no provable ways that we can harm or injure our
Yeah,
patient.
they're there to protect, more so than be proactive.
The deal is, if we're not proactive as sonographers to take that extra picture or go that extra step, then you as the patient don't find out.
So practically, you get, the doctor says, okay, go do this, so you go do it, so they're in front of you, all right, and they're talking.
The patient?
The
Yes.
patient's in front of
Mhm.
you
Oh,
talking.
yeah, it's a hands-on procedure. I'm as sonographers, we're in there with the patients for a good average test takes about 15 to 45 minutes.
So, but the question is this, so you're in there
Mhm.
and you find out you've got somebody who just graduated, 2 weeks ago, and you're doing this, and so you're finding out everything contrary to what you're saying right now. There's no experience,
understand.
there's no licensing, and there's not a whole heck of a lot of choice when the
No.
doctor says you've got to go do this, and this is where you go. So how do you advocate for yourself under those circumstances?
Well, know your facility. Baptist Hospital, Baptist Memphis Hospital over in Walnut Grove has an accredited ultrasound program, accredited ultrasound department, and therefore all of their sonographers have to be registered even straight out of school. At the hospitals, there's a great safety net for sonographers straight out of school. Sonographers straight out of school have senior sonographers and other sonographers to lean on, to work on, to say, come behind them and take a look and make sure they took all the pictures they needed to take. My personal opinion is all straight out of school students should work in the hospital at least for 1 year to 2 years prior to going to any private practice. Because at private practice, the doctors are much more expectant that the sonographer knows everything she needs to do.
So if the doctor sends you for an ultrasound and in the back of your mind go, I wonder if I have gallstones. Can you say to the sonographer,
You can say it, but she cannot look. We cannot look at anything that we are not given an order to by the physician. Best case scenario for that is to self-advocate and tell the doctor, I've been having symptoms, I've been having pain after I eat, I've been having the symptoms of gallstones. Is there any way I could get my gallbladder looked at? If you plant the seed in your physician's head, then he can order the test and then we can do the study. It has to come down from the doctor. I've had several patients year after year after year ask me to look at something extra. Do you do carotid Dopplers? Yes, ma'am, I do. Can you do one on me? If he orders it.
So a physician will look at all, is films the right word?
It's pictures, images.
Will they, regardless of whether you find something or not? They look at
Yes.
all?
Mhm. Yes, absolutely. They will look at all of them. If they think that they have not seen something clearly enough, or if they have a question about stuff, they will send you back in there. They will send you back in there and they will have the sonographer retake the picture. And that not only is for your benefit, but it's also a learning experience for the sonographer. I should have taken that picture again, because we don't want to go back in there, and we've moved on to the next patient or whatever. So yes, it is great to say for them to say, you need to take this other picture. I guarantee you that sonographer is going to take that picture the first time next time. At least I did. So anyway, so that is it. But it does accreditation. Check your facility and see if it's accredited. Okay, accreditation, surprisingly enough, is voluntary. So we have 4 states that have laws, and accreditation is voluntary. Accreditation involves external peer reviews that evaluate the healthcare professionals and make sure that they are meeting the criteria for what needs to be done. It costs money. It's expensive to get accredited, and for years nobody was doing it. But And because it involves non-governmental organizations, it involves federal and state governmental agents. There's numerous studies, but all the studies that have been done on accredited facilities improve patient outcomes. I read 2 or 3 or 4, every study I read last night preparing for this, it improves patients' outcomes. So be honest with your physician. Ask what the test is for. You don't realize that it is less aggressive to cut off a foot with bad circulation than it is to try to fix it.
Wow.
And that's great if it's not your foot. So ask questions, talk to the person performing the test. If they are a sonographer, just ask them where they went to school, if they're registered, when they're getting registered, have they taken any of their tests? You can decipher, how good they're doing. Don't harass, but please don't harass the new sonographers. They're struggling. They're having a hard time too. I've been there, but at the same time, everybody's got to, learn and grow. The main thing is talk to your doctors. Make sure if something comes back questionable, find out what's the next test to do. Read the reviews of your doctor. Check up on your doctor. Not every doctor's out there for that. Why do places get accredited? Places get accredited because this is how it filtered down. The insurance companies found out that sonographers around the country, I've been doing this 24 years, and when I came out, there were very few registered sonographers, and they get registered in one modality and just, stop. About 2000, in the early 2000s, the insurance companies found out that there were very few sonographers that were registered. Insurance companies said, all right, well, I'm just not going to pay for a test that's done by an unregistered sonographer. So then the doctor orders the test, and insurance company says, investigates and says, was this sonographer accredited? Was this place accredited? And the place and sonographer said no. So the insurance company gave the doctor what he was expecting, $500 for that test. They gave him $100. Doctor was like, oh my gosh, what happened? I just lost money. This is affecting my bottom line. Your sonographer's not registered. He looks at the sonographer and says, go get registered. So she goes and gets registered. Wasn't that she couldn't. She probably was a fine sonographer. She'd never taken the test. Tests are scary. Tests are expensive. For every single test, it's $250. And it's not just a test on abdomen or whatever. You have to pass a physics test too. We are heavy in physics. All the ultrasound physics and how it creates the picture. So it's very scary. So then the sonographer goes and gets registered. Well, then more sonographers register. So then the insurance company said, well, great, your sonographer's registered. I'm not going to pay you if your facility is not accredited. So then the doctors started pushing to get their facilities accredited because they wanted to, the reimbursement was better if it was accredited. So what really motivated the doctors to take notice whether or not their sonographer was registered? Because before then, they looked at a registered sonographer and an unregistered sonographer and said, I've got to pay her more than her or him, but there's not a whole lot. It's changing a little bit. This is a female-dominated profession. So bottom line, if money is what it took for the doctor to get accredited, and that was his only reason, it wasn't for anybody, any other, it was fewer reasons of how good was his sonographer or how much was he helping his patients, all the more reason to self-advocate and know who you're going to. Is the facility accredited? It does increase patient care and take care of it. So please self-advocate. Know the laws in your state for who's scanning what and find out who's scanning you.
Do healthcare facilities typically have rules about you supplying past pictures?
We don't really necessarily need past pictures.
Okay.
Pictures, the images come across.
Like as a comparison or something?
In the hospitals, I am all for comparing pictures. And when I had access to it in the hospital, I looked back at CT scans. I looked back at, I cross-correlated. When I was at the physician's office, private practice, I correlated my echocardiograms to the stress test, because the only way to know if your heart's good is to have both. The stress test, if you considered your heart a house, since we have a lot of realtors here, let me play to the crowd a little bit. If you considered your heart a house and you needed to inspect it, your heart's the house. Your EKG, the very first test out of the gate where they hook you up to all the little 12 stickers and they watch the little dot go across the line, that's the electrician. He's checking the electricity of your heart, making sure that it is coming on and off at the same time in a steady manner. Anybody ever heard of atrial fibrillation? There's all sorts of things going on with atrial fibrillation these days. Yeah, that electricity, those lights are flickering on and off all random times of the night, all the time, just every which way, right? That house is haunted. Please, if you have atrial fibrillation, please take your blood thinners. I cannot stress that enough. And people don't want to take them, but you may feel fine. You may feel great.
My mother just recently got a Watchman.
That is a new device, and I have heard good things. It is new, so I don't know the full long-term effects of the Watchman. It is supposed to be able to at least reduce your need for blood thinners, if not completely take you off them. I don't know the specs on that. In fact, I just had that conversation last night with a friend of mine, because her mother struggles with AFib. But we'll see the long-term effects. It's a great idea. And I certainly would not discourage anyone from doing the research on it and possibly looking into it, but it's a new device. And I'm sure in theory, it sounds really, really great. So I'm hopeful that it will be a really good thing for the AFib community. But yeah, so AFib, so the EKG is your electrician, that's your electrician. The echocardiogram, the ultrasound, that's looking at the foundation, the roof, the doors, the walls, the structure of the heart. Yes, I can see the electrical pulse. Yes, I can see the beating, and I know the electrician, we hook you up to watch the electrician, but I only hook up 3 leads to their 12. So I don't get my little EKG, my little 3-lead EKG during the echocardiogram does not give the exact same information as there, but I don't necessarily need 12 because I'm looking at the heart, watching it beat. Okay. But the stress test, the third and final test to figure out if your heart is healthy and check your house out, that's the plumber. That's the plumber. We're checking the pipes within the walls. I don't see the pipes within the walls. I'm looking at the walls themselves. So I can't tell you if a pipe's about to burst or if a pipe's clogged or blockage, as everyone says. I've literally had a patient say to me before, do you check for blockage? No, I can't see blockage. Well, what good's your test? But they all work together, because you can have the most beautiful house on the planet, the most beautiful heart on the planet. Everything structure is great, structure is wonderful, but if that pipe's about to burst or if that pipe's clogged, you got a problem. So that's the plumber. So the doctor, when he orders the EKG, when he orders the stress test, when he orders the echocardiogram, he is doing a full circle evaluation of your heart. Any one of those things can send you to the cath lab, which is the gold standard. All 3 of those things are screeners. They are not infallible. So if they all come back normal and the patient is still got symptoms, you're going to the cath lab. So anyway, I hope this was informative. Thank you so much for your time.
Thank you very much. That was great. Thank you. Wow.
You never know. What you learn at Talk Shop may save your life or someone else's. Hey, Brett, did you want to